Hey, Dr. McNamara here, and today I would like to talk about one of the most common conditions that I see walking into my office, or hobbling or limping. And this condition that I'm talking about is herniated discs or disc bulges. So today our goal is to unravel some of the mysteries that are behind disc bulges and disc herniations, which is a condition that affects millions of people worldwide, as well as discuss some of the myths and debunk those and let you guys know how chiropractic care can really help yield to some really amazing results when it comes to healing discs. So what exactly is a disc bulge or a disc hernia? And for this, it'll be helpful if we come to our anatomy. So right here, I have a little model of our lumbar spine. You can tell it's lumbar based of these mammillary processes on the posterior elements of the vertebra, but just some basic anatomy. So here you have your vertebral bodies both on top and on bottom, and in between those you have your intervertebral discs. And then back here we have our spinal cord, which is being protected by the posterior elements known as the lamina of the vertebra. And then you can see these little spinal nerves that are coming out of these little holes known as intervertebral foramen. So I want you guys to think about your intervertebral disc a jelly donut, meaning that the crispy outside is a little bit harder than the jelly in the middle. So the outside fibers on a disc are known as the annulus fibrosus, and in the middle it is known as the nucleus pulposus. And what happens with a disc herniation is that this area of the disc, the annulus fibrosus, can get compromised, whether it's due to repetitive motion, trauma, or improper posture. It'll get little fissures in here, and then, for example, if you were to bend forward with this type of disc herniation, it would cause the disc herniation to protrude out onto the spinal nerve, causing those symptoms of pain, discomfort, weakness along that nerve. So let's just quickly review that really quick. So between the bones in your spine, there are discs, and these discs act as cushions. A disc bulge or herniation is when the outer layer of these discs, the annulus fibrosus, is compromised, allowing for the inner gel core, the nucleus pulposus, to protrude out, and then this can cause pressure on the nearby nerves and tissues and cause symptoms of pain, weakness, etc., the things that I have mentioned. And this can be, very mild, or it can be pretty severe for some individuals. So you might be wondering, well, how exactly does this happen? And there's going to be some risk factors that include age, degeneration due to wear and tear, an injury from lifting heavy objects improperly, prolonged sitting, or just repetitive trauma in general. Also, there is going to be a genetic susceptibility to this too. So if it's common in your family to have disc bulges, disc herniations, you want to be a little bit extra careful because you might have similar anatomy, which might predisposition you as well. So a common misconception is that all disc issues require some type of surgery, and this is just really not true. In fact, many, if not most, cases of disc injuries will resolve just fine with conservative treatment, and even some will just resolve on their own, and you may not even know you have a herniated disc. But many times these conditions will improve with non-invasive types of treatment. So that should be a last chance type of thing that you're doing if you have a herniated disc. Another myth is that a herniated disc always causes pain. Surprisingly, some people with disc herniations on MRI scans experience no symptoms at all. And the vice versa is true. Sometimes people will have no findings on their MRI whatsoever, and they'll be in all sorts of pain, and it may even resemble a disc. But really, this just shows the nuance of, pain in the body, in particular low back pain, as well as just the body's remarkable ability to adapt and heal itself, which is kind of what we help facilitate here in the office with chiropractic and functional medicine. So how exactly can chiropractors help with disc herniations? Well, for one, we treat all different types of back pain, and disc herniations are no exception. The way we approach herniated disc is we use a wide variety and a range of treatments that are aimed to reduce the pain and improve function. Techniques used are commonly spinal manipulation, also known as adjustments, which this is going to help relieve nerve pressure and increase mobility within the spine. We also use a really phenomenal technique known as Flexion distraction technique. And this technique has been shown to have awesome effects in terms of improving disc pathology and really enhancing the healing process. What we do is we apply a traction onto the spinous process of the vertebra in question, and that upward pressure is going to relieve the pressure that's going downward on the disc at the time. And then we're going to induce some flexion, which is going to help resorb some of that nucleus pulposus back into the disc. And I can tell you from firsthand experience that this technique works phenomenal, and we see awesome, amazing results every single day in the office. A little bit more about flexion and distraction technique. It is a gentle, non-force adjustment that's going to increase spinal motion and resolve disc bulging. This, combined with targeted exercise and lifestyle advice, will set you up to promote natural healing. Understanding disc bulge and disc herniation helps demystify the pain and paves the way for effective treatment options. Chiropractic care, with its holistic approach, has shown remarkable results in managing these types of symptoms and completely resolving them without any type of invasive procedures. If you or someone you know is suffering from a disc bulge, show them this video. There are some of the basics behind disc bulge and disc herniations and some of the misconceptions that people have about this type of condition, as well as the information on how chiropractic care can really improve the results and improve the symptoms that occur as a result of a disc herniation. So I hope you guys learned something really valuable today. And if you like this information, please like and subscribe for more health and wellness. Thank you.